Hello viewers, I am Dr. Sundeep Lakhtakia, consultant gastroenterologist at Asian Institute of Gastroenterology, Hyderabad. Today I will be speaking on common gastro-related problems which we face in our day-to-day life. The commonest problem that people face is gas, which means distension of abdomen, you feel bloated up, you feel like belching, you may have some burning sensation in the stomach. This is often related to increased acidity in the stomach, and this acid which is normally produced in the stomach is excess and comes up in the food pipe and causes throat burning, sometimes hoarseness of voice. At times it can also lead in difficulty in swallowing food. And whenever somebody has these symptoms, it needs to be investigated, especially if these are there for many weeks and it's troubling your lifestyle. So let's go further. If somebody has difficulty in swallowing of food, you feel that the food is stuck here, you need to take more water to push it down. This is a very alarm symptom. It makes you alert. It should make you alert actually, to take you to a doctor and find out if something is happening in your food pipe or the stomach. Often the commonest investigation which is used nowadays is a simple endoscopy, which is a flexible rubber tube with a light on top, by which a doctor can see inside the food pipe and see if any kind of obstruction is there in their food pipe, which can be because of cancer, especially in elderly people or those who are smokers, or sometimes it can be a benign disease like simple ulcer or narrowing because of stricture. It also helps us in finding what's inside the stomach as well. If there's an ulcer, there are medicines to easily cure the ulcers nowadays. The days of surgery required for these ulcers have gone. Another important symptom which I would like to highlight is blood coming in the stools. A lot of people face this problem of blood in their motions, which can be very small amount, sometimes can be larger in quantity. It can be mixed with the stools. It may be associated with some pain while passing motions. Occasionally it may not be red blood, it may be black blood. Black means the blood is coming from the upper part of the intestines, and that's also a very sinister symptom. So whenever somebody has blood in the stools, please do not ignore it. It need not always be piles as commonly thought about. It can actually be an ulcer in the colon or the small intestines, or it can be cancer there. Cancer, if it is picked in a very early stage, is totally curable. Surgeries or endoscopic interventions are available which can cure these problems right in the beginning itself. So never ignore blood coming in your stools. Third thing which I would like to say is jaundice. Whenever you have yellowness of the eyes, it means that the liver is little affected, which can be because of many reasons. It can be because of hepatitis, which often is self-limiting, but you need to investigate further if it is the common garden variety of hepatitis A and E, which resolves on its own and never comes back. But if it is hepatitis B or C, then it needs further treatment, because these viruses then remain inside the liver for many years and can permanently damage your liver. So before that happens, you take action, meet your doctor, find a diagnosis and treat accordingly. Third problem or fourth problem which can happen sometimes is distension of the abdomen. People feel bloated up, which need not always be gas. It can also be water inside the abdominal cavity, which is called as ascites. Ascites is not normally there. It can be because of many diseases including cancer or liver failure. These are two common problems. Third common problem in India is tuberculosis of the abdomen, which can also present as distension. And each problem which manifests as ascites has different treatment option available. So dear friends, take care of your health, look at common symptoms and don't ignore them for a healthy lifestyle. Thank you very much.